Hello, my name is Kylie Hamilton, and today we will be talking about multiple sclerosis. So, what is multiple sclerosis? MS is considered an autoimmune disease in which the body attacks the protective myelin sheaths that cover nerve fibers and causes communication problems between the brain and the rest of the body. MS is potentially a disabling disease of the brain and spinal cord. Eventually, the disease can cause the nerves themselves to deteriorate or become permanently damaged. So what is myelin? Myelin is a fatty protein that coats each axon in a layer called a sheath. The main function of myelin is to protect and insulate these axons and enhance their transmission of electrical impulses. And if myelin is damaged, the transmission of these impulses is slowed down, which is seen in severe neurological conditions such as multiple sclerosis. The course of disease. Most people with MS have a relapsing remitting disease course. They experience periods of new symptoms or relapses that develop over days or weeks and usually improve partially or completely. These relapses are followed by quiet periods of disease remission that can last months or even years. Symptoms of multiple sclerosis. Signs and symptoms can vary widely and depend on the amount of nerve damage and which nerves are affected. Some examples are partial or complete loss of vision or prolonged double vision, tingling or pain in parts of the body, electric shock sensation that occur with certain neck movements, tremor, lack of coordination, slurred speech, fatigue, dizziness, and problems with bowel and bladder function. Some risk factors of MS. These factors may increase your risk of developing multiple sclerosis. So first, age. The common ages are between 15 and 60 years old. Sex. So women are 2 times as likely as men to develop MS. Family history. If someone in your family has developed MS, such as your brother, your sister, your mom or dad, you also have a increase of getting MS. Certain infections. So a variety of viruses have been linked to MS. Race, particularly white Northern European descent, are at an increased risk for developing MS. Climate, so MS is far more common in countries with temperate climates such as Canada, Northern US, New Zealand, and Southeastern Australia and Europe. Also, certain autoimmune diseases increase risk. So if you have thyroid disease, type 1 diabetes, or inflammatory bowel disease. And lastly, smoking. So if you are a smoker, this does increase your chances of developing MS. The diagnosis of MS. So unfortunately, there's no cure for MS, and the cause is still unknown. There are no specific tests. Instead, a diagnosis of multiple sclerosis often relies on ruling out other conditions. You can do this by blood tests, which help rule out diseases with similar symptoms. Lumbar puncture, where a small sample of fluid is removed from the spinal canal. This sample can show abnormalities in antibodies that are associated with MS. Also MRIs, where this can reveal lesions on the brain or the spinal cord. And evoked potential tests, which record electrical signals produced by your nervous system in response to stimulus. Effects of MS on exercise. A really important one is that some people with MS are sensitive to heat, which means they notice that their symptoms either show up or get worse when their body temperature rises. This is a really big factor because as we exercise, our core temperature will increase. So MS patients really have to be careful with this. Also, muscle fatigue and weakness, feeling tired, muscle spasticity, and loss of balance or coordination. Treatment and management of MS. Physical therapy. Physical or occupational therapists can teach stretching and strengthening exercises and show how to use devices to make it easier to perform daily tasks. Also, muscle relaxants. MS patients may experience painful or uncomfortable muscle stiffness or spasms, particularly in the legs. And also medications to reduce fatigue. The most common is beta interferons. These medications are among the most commonly prescribed medications to treat MS. They are injected under the skin or into muscle and can reduce the frequency and severity of relapses. So my case study was on a 45-year-old woman diagnosed with relapsing remitting MS 3 years ago with a grade of a 3.5. So basically, the grade of 3.5 means that she is self-sufficient, she can still move around most hours of the day, and she does not need any aid or any help by anybody. Her height is 5'4". She weighs 135 pounds. Her BMI is 23.2. Her blood pressure is 114/72. Her resting heart rate is 76 beats per minute. She does not smoke, and she has no family history of metabolic or cardiovascular disease. Her electrocardiogram showed a normal sinus rhythm and is within normal limits. She does, however, have a sedentary lifestyle. She only walks a few days a week, if that. So that does count as a risk factor. So based off of this, she does have one risk factor, placing her in the low risk category. The client's goals are to increase ability to perform daily activities, be able to use exercise as a treatment, increase mood, and overall have a healthier lifestyle. Special considerations during exercise. Start slow. There's no need to rush into anything, especially because she's new to exercise. So progression is really important. To keep hydrated, always have a water bottle at hand. Make sure to stay cool. Again, MS patients may react to an increase in temperature. So this means making sure that exercise is in front of a fan or in a cool room or after the peak heat of the day. Also, take time to recuperate after exercise. Do not continue to exercise during times when MS symptoms are worsened. It is best to just conserve energy and rest during these periods. Also, to be safe when exercising is very important by preventing falls and injuries that can happen when the body is tired or when MS symptoms affect balance. So exercise testing. First of all, the client should be cleared and the physician should be contacted before any exercise testing or training. The best protocol to use for MS patients would be a YMCA leg cycle ergometer, beginning with a 1 to 2 minute warm-up period, and then stages will last between 2 to 3 minutes and increase by 10 to 25 watts each stage. The test should last between 8 and 12 minutes, and during the test, you'll be measuring blood pressure, heart rate, VO2, and RPE the last 30 seconds of each stage. So exercise prescription. First, aerobic exercise. This can be biking, swimming, walking. I really want to emphasize swimming because this is the most common form of exercise recommended to MS patients because you're in a pool, it's a cool area, it doesn't really increase body temperature too much. Intensity should be moderate, 40 to 70% of VO2 reserve, or RPE between 11 and 14. The frequency should be starting with 3 days a week and then working up to 5 days a week. Again, no need to rush into anything. So starting at 3 days a week is perfectly okay. The duration should be about 30 minutes. If the client doesn't feel up to working out 30 minutes straight, they can break it up into 3 10-minute sessions throughout the day. Again, just starting slow and working up to it. Carefully progress based on the individual's response to exercise and avoid excessive fatigue. Resistance training. The mode can be machine weights, resistance bands, calisthenics, again, aquatic training. Intensity, 60 to 80% of a 1 rep max. They should be able to perform 1 to 2 sets of 8 to 15 reps of this. And frequency, 2 days a week. Duration, no longer than 30 minutes. So if fatigue increases, just simply take more time to rest in between sets. Carefully progress based on the individual's abilities. So really, again, just listen to the patient's body, the need to rest, take a rest. Balance and flexibility. These two are really important. For balance, simply standing on one foot, walking heel to toe, or side leg raises or front raises. Intensity, twice on each foot, 10 to 15 reps, or if you're walking heel to toe, just about 20 steps. Frequency, at least 2 times a week, and time, about 10 to 15 minutes. Flexibility should be static stretching large muscle groups, so the quadriceps, hamstrings, triceps, biceps, anything like that. Intensity should be to the point of a tightness in the muscle, but no pain. Frequency, before and after every exercise session would be a really good time. Duration, so holding each stretch for about 30 seconds, 2 to 3 times. Mind and body activities. These are good activities, so yoga, tai chi, chair yoga. If the client really wants to try something new, these are great activities to improve core strength, balance, and flexibility. So in conclusion, exercise has many benefits for MS patients. MS patients will experience an overall better quality of life through exercise. Exercise will encourage a more positive attitude and also increase participation in social activities. This one's a big one because MS patients often find that they can't be a regular person or they don't feel that they can do normal things. So getting them to join a gym or start exercising with family or friends is a really good way to help them participate in social events. And last but not least, just go out and exercise and be healthy. And this is my works cited. Thank you for listening.